Hi, my name is Chris Netting, and I'm a thyroid cancer expert working in London. Many people come to see me because they're concerned about nodules in their thyroid gland, which is in this position here in your neck. As an oncologist, my main concern is to rule out if any of those nodules could be malignant or cancerous and need further treatment. People should be reassured that the vast majority of thyroid nodules, over 90%, are benign, not cancerous, and require no active treatment. Patients live with them for all their life. In a small proportion, however, a thyroid cancer is identified and needs further treatment, usually with surgery and sometimes with radioactive treatment. The assessment of a thyroid nodule includes understanding a bit about history of the patient, their age, previous medical history, family history of thyroid cancer, any risk factors such as genetic history or radiation exposure. And in addition to that, normally an ultrasound and possibly a fine needle aspiration biopsy is required to rule out those small number of nodules which can be cancerous. The ultrasound is done by a specialist radiographer. It's a scan which uses some jelly on the neck and a probe over the thyroid gland to look in detail at the nodules, their size, shape, blood supply, and other factors. In some patients where the nodules look suspicious, a fine needle aspiration biopsy is repeated as well, where a small nodule can be biopsied through the skin under local anesthetic and some cells sent to the lab for further analysis. The whole procedure takes a few minutes and can be done in the outpatient setting. After this, I meet with patients, I go through the ultrasound reports, the needle biopsy tests, and advise them on the risk of malignancy and whether further treatment is required. In some patients, a diagnostic procedure to remove the nodule with an operation is required. In other patients, thyroid cancer can be diagnosed on the tests in the first instance. Either way, I'll take you through the options, the treatment recommendations for who to see, and set up an arrangement for this to be dealt with for you.